The phalanges are connected together by three joints in fingers that are the metacarpalo-phalangeal joint and two interphalangeal joints. That is, the proximal interphalangeal joint and the distal interphalangeal joint. Then we have two joints in the thumbs that are metacarpalo-phalangeal joint and interphalangeal joint. Now let's discuss the first joint, which is the metacarpalo-phalangeal joint. These are the condylite synovial joints. It is a joint formed by the fixation of condyle in oval articular facet. It allows all movements in two planes. For example, flexion, extension, adduction, and abduction. As the name tells us, it connects the metacarpal bones to the proximal phalanges. The end of metacarpal bone is rounded. Base of proximal phalanx has an articular facet to which it gets fixed and forms a joint. This joint makes the finger stable and flexible. Now coming on to the next joint, which is the proximal interphalangeal joint. It is a hinged type of synovial joint which allows two movement, flexion and extension. It connects the proximal and middle phalanx. Head of proximal phalanx articulates with two articular facets on base of middle phalanx, forming the proximal interphalangeal joint, which is known as the PIP joint. This joint actually helps fingers to grab things and allow flexion and extension. Now moving on to the distal interphalangeal joint, which is also a hinged variety of synovial joint. You know what does that means? That means it allows flexion and extension. Now moving on to the interphalangeal joints of thumb that connects proximal and distal phalanx of the thumb. Remember I told you thumb has two phalanx? And it is also a hinged variety of synovial joint, which means only flexion and extension are possible at this joint. Distal interphalangeal joint connects the middle and distal phalanx. Base of distal phalanx has two facets for articulation of the middle phalanx head. As we have discussed the joints, let's move on to the ligaments. Ligaments are very important to provide stability to the joint. For phalanges, we have collateral ligament, palmar ligament, and a deep transverse collateral ligament. Now starting with the palmar ligament, which is a thick, dense, fibrocartilaginous structure placed on the volar surface of the joints in the interval between the collateral ligaments. The second ligament is collateral ligament, which is a strong ligament on either side of the MCP and IP joint, and which actually prevents the sideways movement of the joint. Then we have the deep transverse metacarpal ligament. It connects the second, third, fourth, and fifth metacarpal bones, connecting them all together. That's it for the ligaments. Now let's move on to the movements.